Hello and welcome to this podcast on the geriatric topic of falls. My name is Mohammed Farid Jabir. In this podcast, we'll be primarily looking at the risk factors for patients suffering falls, looking at the falls risk assessment, looking at addressing issues with regards to the risk factors leading to falls, and also any interventions that can be arranged to prevent falls. It is important to note that falls are leading cause of morbidity and mortality in seniors. Falls in the elderly are also the leading cause of injury admission to an acute admissions department. Usually it's best dealt with in a holistic manner involving other healthcare professionals such as occupational therapists, physiotherapists, nurses, as well as social workers as well. Falls are often multifactorial, determine intrinsic risk factors which predispose patients to having falls or even recurrent falls, and these can be primarily divided into sensory causes, musculoskeletal conditions, central integrative, and systemic causes. I'll go into the breakdown of each of the following in later on in the slides. It is also worth noting that the first three risk factors, that sensory, musculoskeletal, and central integrative, are involved in maintaining balance and stability. When evaluating an older patient having sustained a fall, determine which intrinsic factor the patient has and address risk factors causing further risk of falls. This involves taking a falls history, assessing patient's gait and balance, identifying if the patient is at risk of osteoporosis, has a fear of falling, any visual impairments or cognitive impairments, any issues with continence, any home hazards, i.e. environmental risk factors at home predisposing to falls, and also lastly but most importantly, medication review. Coming down to the breakdown of different conditions of the different risk factors in each condition. Sensory causes such as hearing loss, visual impairment, and abnormal proprioception could be assessed by simple examinations such as assessing hearing, vision, doing a neuro examination, assessing proprioception and range of motion. Musculoskeletal conditions such as arthritis, foot disorders, and muscle weakness could be addressed by doing musculoskeletal examination of feet and assessing muscle strength. Central integrative conditions could be such as dementia, depression, and gait disorders. Screen for impaired cognition, depression, and assess gait here. Systemic conditions such as metabolic processes such as hypothyroidism, acute illnesses such as urine infections and chest infections, which are common in the elderly population. Elderly population also suffer from postural hypertension and cardiovascular causes as well. Simple lab workup such as bloods could address these conditions, as well as doing simple workups such as lying standing blood pressure and ECGs can rule them out. Multifactorial interventions are basically programs where the following risk factors are addressed, and is usually individualized at elderly folk who are at risk, and primarily involve educating them, helping with strength and balance training. That's where the physiotherapist and the occupational therapist are involved. Home hazard assessment and intervention, again the role which the occupational therapist assesses. Vision assessment and referral, and medication review or withdrawal. That's about it for this quick podcast on falls. Thank you and goodbye.